Hi, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the board-approved CE providers here teaching massage and body work. We primarily teach to the Florida Board of Nursing, Board of Massage, and Board of Cosmetology, plus we teach board-approved CE classes for NCB TMB, that's the National Board for Therapeutic Massage and Body Work. So many therapists across the country who need those hours are also taking our training. The common theme here is that we teach mostly to licensed professionals. So everybody's welcome to take our training, but hopefully you are not practicing massage or body work unless you are licensed, because we are going to review pathogens and massage contraindications right now, but there are many, many more beyond what I am going to review in this short, brief training. This training is part of a larger course unit that reviews sanitation and germs in the massage therapy workplace, but I decided to extract a small portion of that training unit and share it for free here on YouTube so everybody could benefit from this information. There are 4 common categories of germs. They're virus, fungi, protozoa, and bacteria. Germs can also be called microbes or microorganisms, and they can cause infectious disease. When germs enter our bodies, they can reproduce and cause illness and other symptoms. Germs can spread from one person to another. Sometimes infectious disease are also called communicable or contagious disease. Microbes that cause disease are also called pathogens. Viruses are very small and the most common cause of illness. The common cold is a group of symptoms caused by over 200 different viruses, including coronavirus. There are always more cold viruses that have yet not been identified. The list is ever growing. Viruses can cause intestinal and respiratory flu. And while antibiotics can kill bacteria, an antibiotic cannot kill a virus. Fungi includes yeast and molds, and they are everywhere. They can survive on surfaces for very long periods of time. Fungi can cause common skin infections such as thrush, ringworm, athlete's foot, plus scalp and nail infections. Protozoa are microscopic germs. Examples of protozoan infectious disease include malaria, giardia, and toxoplasmosis. A single organism can multiply in humans to develop into a very serious disease. They're one-celled organisms that can be free-living or parasitic in nature. And just like bacteria, some protozoa are considered good and some are very bad, such as the protozoa that causes malaria, giardia, and toxoplasmosis. Bacteria are more complex and larger than viruses. Some bacteria can survive on surfaces for long periods of time, feeding off dirt or food or water. Most bacteria are harmless or even beneficial to us. They can help us digest food as well as prevent infections caused by harmful bacteria. And some harmful bacteria can cause serious infections and disease. Now that we've reviewed the 4 most common types of germs, I'm going to review some medical massage contraindications and precautions, infectious and contagious situations for your benefit. Keep in mind that this is not a total list or an exhaustive list. There are other types of infections and contagious disease beyond the time we're able to review with you here. And if you come across a medical condition, infection, contagion, or what have you, and you're not sure of how to handle it, if you should proceed, if it's safe to work on the client, you can always check with their physician for medical advice. Well, we're going to provide plenty of do's and don'ts with this education about infections. We can't advise on every individual case. Some cases have to be determined by the individual and what they're presenting and the severity of the disease and how far they are past their acute phase or if they've healed. If you're unsure of any of the information that we're providing you and how it applies to your client, you should simply check with the client's physician. That would be the best way to determine whether or not you can work. I'll also review a few infections that your clients may have, and while they might not be infectious or contagious, it would be ill-advised to work on some of these infections. Let's begin. Anyone who has a fever could have a possible infection. That's one of the ways our body fights infection is by developing a fever and raising our internal body temperature to fight the infection. So we say that fever, especially acute and new fever, is a massage and bodywork contraindication until it is medically diagnosed why the client has a fever and it's ruled out that they are not infected with something or contagious. Active chickenpox is a highly contagious virus. Even if you've had chickenpox and feel that you're further immune from this disease, the skin is usually so broken that the broken skin itself would be a contraindication. Massaging over broken skin could lead for greater infection of other bacteria and harmful agents. So it's really important to not work on people who are actively infected with chickenpox. Cellulitis is often caused by a bacterial infection. Now, while the risk of transmitting cellulitis, this bacterial infection, from an infected individual to someone who's not infected is quite minimal, you wouldn't want to massage someone with cellulitis. You wouldn't want to spread the bacterial infection within them. And often the skin and soft tissue will be swollen with the infection. You need to wait for this to be treated by physicians, usually by antibiotics, before you would be able to work on somebody who's had cellulitis. The flu, which is also known as influenza, is a highly infectious viral disease. This is usually affecting the respiratory system, although other symptoms can be felt throughout the body, such as muscle aches, pains, fevers, headaches, and more. It is highly infectious. We would not work on someone who's had the flu until several days after they are no longer presenting symptoms. The flu is known to be a respiratory disease. However, an infected person can exhibit other symptoms such as body aches and pains, headaches, and fever. Now, I recommend that massage therapists sometimes do follow-up calls with their clients after they've received massage or body work. One of the benefits of those follow-up calls is you might learn that a client has a flu or some other contagion shortly after visiting your office. So when you make up those follow-up calls, it gives you better information whether or not you might have infectious contagions in your office and whether you should spend extra time sanitizing your office due to that exposure. We have training here at CE Institute to help you learn more about proper sanitation within your workspace, especially when you've been exposed to contagions and disease. Impetigo is a highly contagious bacterial rash on the skin. You'll usually see fluid-filled blisters, which could be mistaken for poison oak or poison ivy. You want to make sure that all lesions on the skin are completely healed before massage is considered for that client. Almost all infections or inflammations could be considered a bodywork contraindication. You do have to take these one by one because sometimes it might just be a local contraindication and sometimes it's a full body contraindication. If you're unsure, checking with the client's physician, hopefully they'll be able to tell you whether or not prolonged contact with the client could be harmful for the client or yourself or both of you. If a client shows any signs of infection or inflammation, you should stop your body work immediately if you have already started it. And of course, performing a thorough medical client intake prior to the start of your service to rule out potential contraindications is best practice. Lymphangitis is an infection of the lymphatic vessels, namely the lymphatic capillaries. This often creates redness and swelling of the soft tissues of the body. In this picture here, you might be able to see on the fingertips, on the proximal interphalangeal joints, how swollen those are. It's doubtful the client has full flexion of those fingers. Make sure that you're not massaging or applying pressure or increasing circulation or even touching this infection. It is contraindicated. Meningitis, when caused by a viral infection, is highly contagious. It can also be lethal. We're not going to massage anybody who has viral meningitis. While meningitis is simply an infection of the meninges, sometimes an individual could have meningitis without an infection. However, infectious meningitis is usually the most common that you'll see, and massage would be contraindicated with this highly infectious disease. Pneumonia is an infection of the lungs, and like meningitis, the cause of the pneumonia would determine whether or not it's infectious or contagious. If it's bacterial pneumonia, then that would be infectious because the bacteria that caused one person's pneumonia could also cause someone else to develop pneumonia as well. The microorganisms of bacteria that could cause pneumonia would be the infectious agent. So in that case, you'd avoid risk and exposure by just simply not working on the client. They would be contraindicated for massage or body work. Also, people with pneumonia, even if the pneumonia was caused by some type of chemical exposure and damage to the lungs, those individuals might have medical distress with breathing. I would not work on somebody who's in new and acute medical distress with breathing. I think positioning them on the massage table might be really difficult. If they digress during the treatment, we're going to have to terminate it short anyways. I'd like somebody to be a little bit further along in their treatment plan of getting over their pneumonia, if not completely cured, before working on them. Keep in mind that pneumonia can be caused by both bacterial or viral infections, and both can be infectious. Scabies, mites, and lice are all parasitic infections that are highly spreadable, transmissible. These bugs are very small and they can crawl from one person to the next. They could be under your fingernails, on your skin, and you might not even see them or notice, but you would have a parasitic infection. Anyone with these types of parasitic infections would be contraindicated for massage or body work until their infection is completely eradicated. Active tuberculosis is a highly contagious bacterial infection, and you would want to avoid this at all costs. It could be lethal, especially to somebody who has a pre-existing respiratory disorder such as asthma. Now, tuberculosis can become dormant over time, and there are some medical treatments that can be provided for it. However, it's never fully cured. You'll always have the infection once you have been infected. When somebody's dormant and not active, and simply has a diagnosis of tuberculosis, they're over their active phase, it may be safe to massage these clients. That will be a business decision up to you once you learn more about tuberculosis. I personally had a news correspondent who used to do reporting in third world countries and acquired tuberculosis back in like the 1970s. And she's lucky she lived. She had a very serious infection at the time, but now it's been dormant for many, many years. And I work on her and I feel that it's safe. And I just try and keep my eyes out. If she was actively coughing and sneezing more than normal, I probably would deny the appointment and send her to see her physician for a checkup. Acne, which is commonly found on the face or back, is a bacterial infection. In fact, it's commonly treated with antibiotics when it's a grade 3 or grade 4 infection. You're not going to work over broken skin, and you're not going to push anywhere there's swelling. The sebaceous glands are regularly clogged, creating greater inflammation within the skin. So while acne is not transmissible and infectious, it is an infection that is usually quite painful and could lead to greater infections because of the broken skin, and as such is a local massage and bodywork contraindication. Athlete's foot is a fungal infection of the feet. It is usually a white scaly rash. It could have some pus. There could be broken skin, and it can be highly contagious as well. It's often picked up in locker rooms and saunas, and places where you might have whirlpools at your establishment. So hopefully you are properly sanitizing your workspace to avoid the transmission and acquisition of athlete's foot. This is a local bodywork contraindication, and usually working on other areas of the body are safe as long as there are no other precautions or contraindications. Skin and soft tissue burns are a local massage contraindication, not because they're infectious, but because the tissue is damaged that would normally protect the body from infections, from harmful pathogens. Therefore, it is a local contraindication to work on or around a skin burn or broken skin to avoid introducing harmful pathogens to the area that could cause disease. Herpes or cold sores or another type of viral infection, which is highly infectious. There are several types of herpes viral infections, including herpes simplex 1, which would be around the mouth and facial area. Herpes simplex 2 would be around the genitals and also show as these sores or blisters on the skin. There's also something called herpes Winslow, which is much less common, and it's when there's a little bit of infection, swelling, and sores around the fleshy parts of your fingertips. You would never work on the client when they have an outbreak of an acute viral infection that leads to broken skin. I would consider this a local bodywork contraindication. And then if a client had cold sores, I might do a full body massage on them. And just know that your face cradle is going to require additional and extra sanitation. Make sure you're observing full contact times with your disinfection practices if you have worked on somebody with herpes simplex 1. Thrush is a fungal infection. Its official name is oral candidiasis, and this appears as a white film over the tongue itself. It's generally not considered to be a bodywork contraindication, despite most infections being one. Oral thrush usually cannot be transmitted during regular massage or bodywork practice. I would just avoid any intraoral work. Okay, so if you're taking our trigger point training and we're doing intraoral work, that would be contraindicated, a local contraindication for somebody who has thrush. Usually people with poor immunities are affected with thrush, such as clients who are infected with HIV. For people with skin rash or dermatitis, this has to be handled on a case-by-case basis. Do they have this because of some type of infectious agent? Or is this just caused because of a chemical laundry detergent that the client is having a poor reaction to? Regardless of the cause, if there's broken skin rash, that is a local contraindication. And if they have a skin rash due to parasites, then I wouldn't work on that client at all to avoid transmission of a parasitic infection. When you have a client who has dermatitis or any type of skin infection, you need to further evaluate this for greater information to determine whether or not they are indicated or contraindicated for massage. HIV or AIDS is not a massage or bodywork contraindication. I'll repeat that. HIV or AIDS is not a bodywork contraindication. In the third stage of HIV, which is AIDS, acquired immunodeficiency syndrome, the client could require special precautions, and let me review what those are. First of all, an AIDS client could have a very low immunity. Therefore, if you are just getting over a cold or flu or any type of contagious disease, you should not be working on a client with AIDS, because what you are able to heal from, your client with AIDS may not. Their immunity could be extremely poor, and even the simplest virus could be lethal for them. You also want to be alert for any type of bodily sores, specifically with clients who have full-blown AIDS. If that's the case, there may be sores around the body, and you want to avoid pressing or massaging or manipulating directly over the sore or around the sore to prevent any type of tearing or tugging on the broken skin. In advanced AIDS cases, sometimes the muscle integrity and bone integrity can also be poor. So gentler, more passive maneuvers for those clients would be advised. Also, if the client becomes feverish or is medically deteriorating during your massage and body work, including things such as struggling breathing and so forth, just like any medical condition, you should terminate it immediately, your massage session immediately, and seek greater medical help to ensure that the client can receive appropriate medical care from whatever deterioration they've suffered from. Lyme disease is an infection that can be caused by usually a deer tick bite. And if you are infected, you might have something called a bullet, where there'll be a large red, swollen, raised circle in the area where you have been bitten by an infected deer tick. Now, there's no evidence that shows that Lyme disease can be transmitted from one person to another, and definitely not during regular massage. However, the person can experience rash and flu-like symptoms during the acute phase. So, and if there's any type of skin rash, that would be a local contraindication. So in some cases, we're not going to work on clients with an acute Lyme infection. This would be a case-by-case type of situation where you're going to evaluate the client for further medical conditions to determine whether or not they can be massaged. Shingles, which is also known as herpes zoster, is not transmissible unless the person who is in contact with somebody who has shingles has never had the chickenpox virus. If you've never had chickenpox and come into contact with somebody who has shingles, you are likely to acquire chickenpox, because that is highly infectious for people who have never been infected. Now, herpes zoster or shingles, they're called this, it's the same thing regardless of how you call it. You would not work on somebody who is in the acute phase and has pus-filled blisters. Anytime someone has skin deterioration or they have compromised skin, we would never press on this. We don't want to work over any broken or damaged skin, especially in the acute phase. So make sure the blisters have healed, and make sure that you're not working on people who are of low immunity and so forth. If you are infected, just because you have shingles and you've had chickenpox doesn't mean that you cannot infect other people. If your client is infected, you've had chickenpox, you're not worried of shingles, then that's one thing. But if you are infected with shingles, also known as the herpes zoster virus, you should not practice at all, just in case somebody has never had chickenpox, maybe they've mistaken their past diagnosis and so forth, and all of a sudden you've made somebody terribly sick with your own infection. We're going to conclude this training right here. This is only a portion of a unit that's trained in a larger many-unit course for sanitation here at CE Institute. We want to remind you that when working with clients, there may be individual factors that come into play above and beyond what we're sharing in this PowerPoint presentation. There's no one-size-fits-all massage contraindications, especially when working with somebody who was diagnosed with tuberculosis exposure 30 years ago and so forth. You want to be really careful with some of these infectious situations, but in others, they might be perfectly fine to work on. You need to consult their physician if you're unsure. Now, while we're going to end this training here, there is a lot more to learn, and we hope that you do visit our school. You can visit us virtually at CE, as in continuing education. That's ceinstitute.com. And when you register for our home study training, that's available to you instantly. We send you an email, and you can log into your training automatically. And you have it until the course access expires. You can review it right away. So if you want more information, we have more for you. It's waiting for at the school. Okay, so keep in mind, again, this was just a partial list of contraindications. Some of the more infectious and contagious situations to consider, but there are hundreds more infectious contraindications beyond what we've reviewed for almost the past half hour now. Hopefully you've reviewed a lot of that in class already, and some of that was a review for you. So until we see you in another training, we want you all to be safe, and we hope to see you back here at CE Institute real soon.